So let's begin. The numbers speak for themselves. Indeed, the numbers do speak. Statistics show that 76% of U.S. workers reported at least one symptom of mental health condition. 84% of respondents said that their workplace conditions had contributed to at least one mental health challenge. Here in the Bahamas, the number of mortalities, that's deaths, due to mental illness and alcohol abuse was 25 in 2014. Now that's an alarming number because one is one too much. Globally, 15% of working age adults were estimated to have a mental disorder in 2019. And listen to this. An estimated 12 billion working days are lost every year to depression and anxiety at a cost of $1 trillion, yes, $1 trillion per year in lost productivity. These numbers are certainly alarming, and they have most likely increased over the recent years. But they show us the grave picture of the impact of mental health in the workplace. So let's get into this. Let's look at a working definition for mental health. What exactly is mental health? For this session, I chose the World Health Organization's definition of mental health because it's a simple definition and it applies to everybody. So let's look at this. Mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So that is a simple definition of mental health, and I think it demystifies mental health. It continues to say that mental health is more than the absence of mental disorders. It exists on a complex continuum, which is experienced differently from one person to the next, with varying degrees of difficulty and distress, and potentially very different social and clinical outcomes. I know that's a mouthful, but what I want to emphasize is this. Mental health is more than the absence of mental disorders. So just because you may not have a clinical condition or a diagnosis of a mental illness, it doesn't mean that you are mentally healthy. Take note of that. For example, you can be free of any anxiety disorders, but still mismanaging stress or anxiety, which can cause poor mental health. It's not about whether you have or do not have a mental disorder. It is about achieving a state of being well or healthy, having a healthy sense of self-awareness, and being functional or productive. Now that we understand what mental health is, let's look at the important role that mental health plays within the workplace. Let's look at some more statistics. Almost 60% of the world population is in work. The average worker spends 20.78% of their time at work annually. So all that is saying is that for the worker, the most time that you spend is at work. So with these statistics, it is critical that we have a greater understanding and awareness of mental health in the workplace. It is vital to ensure that the work is a place where good mental health can be both sustained and supported. And a critical truth that organizations must take into consideration is that all workers have the right to safe and healthy work environments. I'll say that again. All workers have the right to safe and healthy work environments. A lack of recognition on the need to promote workers' well-being may give rise to workplace problems such as stress, conflict, alcohol and drug abuse, burnout, and mental health disorders. Research shows that a healthy and happy workforce is a productive workforce. Now that we are aware of the importance of mental health in the workplace, it is necessary to stress one fact: that mental health is no less valuable than medical or physical health. And that is what this statement is saying. Medical and mental health care are of equal value for workers. That bears repeating. Medical and mental health care are of equal values for workers. So the same care and attention that we give to our physical health is the same care and attention we should give to maintain good mental health. Just as there are negative consequences when we neglect our physical health, there are also negative consequences when we neglect our mental health. We are more than our physical bodies. In order to be healthy and functioning, we must pay attention not only to our bodies, but our minds and emotions as well. Holistic health is the key to well-being. Keep that in mind.